Case summary. Lola Teresita Santiago is an 82-year-old retired principal in Laoag City who still has so much life and purpose in her. She lives with her daughter Lorna, a 56-year-old woman, and her 12-year-old grandson Angelo. Despite having severe osteoarthritis that makes walking and climbing stairs painful, Lola refuses to let it stop her from serving her church and leading Sunday school. She uses a cane and applies herbal compresses to manage the pain.
Two doctors have advised her to undergo knee surgery, but Lola has turned it down. She worries about the high cost and fears that she might lose the ability to walk after the operation. For her, as long as she can still walk and fulfill her responsibilities, she's fine. Lorna, however, feels anxious about her mother's safety, and especially the risk of a serious fall, and insists on a medical intervention. This difference in priorities often leads to arguments, with Lorna focused on physical safety and Lola choosing to hold on to her independence, spiritual wellness, and the life she loves.
So in the case, several determinants of health are also involved. In Lola Teres' case, it involves multiple determinants of health, such as number one, the biological health, which is age 82 and osteoarthritis. Social, which the church role and leadership supporting mental and emotional health. Economic high cost of surgery influences her decision. Cultural and personal beliefs, valuing independence, herbal and remedies, and also spiritual awareness. These determinants shape her health decisions, highlighting interplay between biomedical and holistic health models. Respecting her perspectives allows healthcare professionals to support her autonomy while promoting safety and quality of life.
The holistic model of health emphasized that the importance of spiritual and social well-being, as seen in Lola Teres' dedication to her physical health despite her osteoarthritis. She values her spiritual and social connection despite her condition. The biomedical model of health, on the other hand, focuses on the physical, body, and mental treatments to restore health. Lorna, a daughter, followed this model to support her mother's need. Surgery, believing it will be improving by the mobility itself and prevent falls and enhance overall health. Both models contribute to understanding how people view and manage their well-being.
Theoretical analysis of the situation. From a nursing theory lens, Lola's stance is understandable. In the role performance and eudaimostic frame, she is healthy as long as she can fulfill meaningful social and spiritual roles. Her refusal of surgery is an exercise of anatomy and risk appraisal shaped by perceived risk, surgical complication at advanced age, financial concern, and the trust in non-surgical coping strategies. Ethically, this raised the classic tension between anatomy, Lola's right to refuse, and beneficence, non-maleficence. Lorna worry about fall risk. Family decision-making in the Philippines is commonly relational, and children often act as advocates, caregivers, which can intensify conflict when values differ.
Clinically, the literature shows selected octogenarians can benefit from knee arthroplasty, but patient selection, comorbidities, and perioperative risk must be carefully weighed. Conservative management remains reasonable for some older adults. Thus, Lola's choice is within an acceptable clinical spectrum, but it raises preventable risks that nursing interventions can mitigate.
Fall prevention. Make the home safer with grab bars, clear walkways, and downstairs sleeping arrangement if needed. Family education. Teach Lorna safe caregiving techniques, stress management, and connect her to local services. And the advanced care planning help Laura create a written plan for future health decisions to ensure her autonomy is respected.
For appropriate nursing intervention, First is shared decision making. Arrange a family meeting with a healthcare provider to discuss Lola's values, explain surgery risk and benefits, and put her wishes in writing. Next is geriatric assessment. Check mobility, fall risk, pain, nutrition, and overall health. Refer to physical therapy for strengthening. Next is pain and function management. Use non-surgical options like analgesics, joint supports, cane training, and gentle exercises, and explore community programs.
This case reflects a common reality in the Philippines where the high cost of medical care often influences health decisions, especially among older adults. Even with PhilHealth or other government programs, out-of-pocket expenses for surgery, hospital stay, rehabilitation, and medication can still be overwhelming for the families. Many elderly patients like Lola Terry choose to avoid costly procedure and instead rely on traditional remedies, herbal medicines, and faith for coping, prioritizing their current mobility over uncertain surgical outcomes. This financial barrier contributes to delayed treatment, high risk of complications, and reliance on home-based care. In public health, this highlights the urgent need for more affordable, accessible surgical interventions and stronger community health programs that consider both the economic and the medical realities faced by the Filipino people.
Discussion Guide number 1. Which health models are in conflict between Lola and Lorna? First is clinical model. This model sees health as the absence of disease. Since Lola has osteoarthritis and refuses surgery, Lorna worries about her safety and insists on a medical intervention. Second is eudaimonistic model. This model sees health as a person's ability to reach full potential, including spiritual and social well-being. Lola believes that as long as she can walk, teach Sunday school, and attend church, she is healthy even with pain.
Number 2. What are related and cultural determinants shapes Lola's beliefs and decisions? Lola wish to forego surgery is influenced by her age. She values routine, comfort, and avoiding major medical operations at the age of 82. She is also concerned about the expense and the possibility of losing her mobility following surgery. As a Filipino elder and religious leader, Lola places high cultural importance on family peace, spiritual well-being, and customs like using herbal compresses instead of running the risk of getting sick or burdening her family. She decides to put up with the pain. Her perspective on health and healing is shaped by her spiritual convictions and her experiences as an elder. Number 3. How can nurses balance respect for patients' values with advocacy for long-term safety? Nurses can balance respect for a patient's values with advocacy for long-term safety by building trust through respectful dialogue, using motivational interviewing techniques, exploring alternative options, involving family in care planning, and documenting patients' preferences clearly. This approach allows nurses to understand and respect the patient's value while also ensuring their safety and being.